Hey everyone, welcome to APTA Live, the Maximizing the Clinical Experience. My name is Casey. I'm the current Director of Communications for APTA Student Engagement Group and your host for this evening. Tonight we're joined by Will Stokes, Doctor of Physical Therapy, OCS, who is also a clinical instructor at the Greg Ott Center for Physical Therapy in Mooresville, North Carolina. I'll give our guest a chance to introduce himself and give a little bit of background. But before we start on this topic for this evening, if you'd like to introduce yourself, everyone who's tuning in the comments, tell us where you are located, where you're going to school, and what year you're in. That would be amazing. And if you'd like to spread the word about this event and tell people what you think, continue the conversation, use the hashtag APTA Live. And if you don't follow us on social media, you can find us on Twitter, Facebook, and Instagram at APTA Students. If you have any questions throughout the discussion, please drop them in the chat and we'll do our best to make sure we answer them. We'd love to hear any of your thoughts. So now let's get to know our guests. So Will, can you please tell us a little bit about yourself and your background and what you currently do?
No, thanks, Casey. Thanks for having me on. So my name is Will Stokes. I'm a physical therapist here in Mooresville, North Carolina, which is kind of right smack in the middle of the state. I work in a private outpatient clinic. We primarily see post-surgical patients, everything from joint replacements, athlete injuries, military injuries, work injuries, anything you can think of that requires surgery. We're a go-to facility for that. I worked here since I graduated from PT school in 2016. So on that fringe of it's still fresh, but I've got a few years under my belt so far. I've got a wife and a preschooler at home, starts preschool this week, so we're excited for her. And I've been a clinical educator here for about 7 years or so. I've had the opportunity to be able to teach a lot of students different rotations, different lengths of time, different moments in their education. So I've been able to really grow in that world, enjoy it. I've enjoyed it. They've enjoyed it. And so I hope to continue that in some way, shape, or form. I've been able to be active in the association for a while since I was a student, and now as a experienced clinician. And I hope to take some of that experience with me in my next career, which will be transitioning into the military as a physical therapist, hopefully in the next little future. So, but excited. But thank you for having me tonight. Looking forward to our chat.
Awesome. Thank you so much. So let's get started with some of the questions that we have for tonight. So the first question that I have for you is, what skills should a student come prepared with for their first clinical rotation?
That's a good question. When I have students who reach out and introduce themselves on their first rotation, I always kind of give them a heads up on just, relax. I want them to feel comfortable. What I look for in that first rotation is to see where they are. Most times they've at least covered orthopedics, some clinical practice classes so far. Just depends on their school. So and where they are in their curriculum. So if they've either already had most of their core classes or are in the midst of it, I kind of use this first rotation to see where they are, see what they're super comfortable with, and see what they need to what they work on, what they need to work on. And so I just ask them those questions. What are your strengths? What are your weaknesses? What do you like to do? What do you find fun to do? What do you find hard to do? A lot of times, like I kind of start off the rotation with just letting them introduce themselves to patients. A lot of times, depending on depending on the program, a lot of times students haven't really had a chance to really meet patients, specifically, real world, real life patient interactions. So I kind of recommend those soft skills of just introduce yourself, just kind of start up a conversation, and just meet the patient, ask them what happened or what they like to do, what are their hobbies, and ask them how they're feeling so far, and just let them kind of really feel comfortable of being in a facility that sees a lot of different patients for different things, and especially here being kind of post-surgical, we see patients for a long time, which is great because we get to really build a great rapport with them. And so the students, even on a first rotation, really get to experience those skills of those interpersonal skills, the verbal, nonverbal skills, those things that are kind of in the inner mind, but not on the forefront. We're kind of in that practice first mentality. And so, but you still have to, feel comfortable and confident with those soft skills. So that's what I kind of recommend from the get-go for anyone in their first rotation to, just, prep and hope to experience.
Definitely. Thank you.
Mm-hmm.
So the next question is, are there things that you've experienced students doing in the clinic that you would recommend maybe avoiding?
It's great. No, that's a good question. I mean, I would say, we're all human. We all have these, I don't know what you want to call them, pet peeves or anything like that. But I know I'm sure I do, and I've probably been called on it more than once. But I would say the things that I've seen students do that I would recommend avoiding is kind of being disengaged. I mean, sometimes it can get a little slow or laggy, and not as fun, fast paced in some days. And so, I mean, when you have students who sometimes you can see that they kind of quickly lose interest or something like that. I always tell them there's always something to do. In spare time in between patients, we can work on interview skills and diagnostic tests, treatment procedures, different things like that. Or as well as if it's a patient that you've that the patient or the student has been working with, and they kind of might have lose interest or something, or lose that enthusiasm to work with them. I'm like that can sometimes be displayed on the patient. The patient might also see that disinterest, and the patient might lose their motivation. So I always say, always kind of, just keep pushing that patient, keep finding new challenges, new things to experience, and challenge yourself, challenge the patient. Incorporate things that you might like. If you like more manual skills, or if you like more neuro focused skills, or anything of that nature, incorporate them. Let's research it and incorporate it, and that'll keep that engagement there. And then that way, it's a much it'll yield a much better experience for everyone. Patients, staff, everyone included.
Definitely. So the next question is kind of switching gears to more of a memorable experience, of a positive experience that you've had with students from clinical rotation that you can share, and why it had an impact on you. Because if we, hearing as a student an experience that a clinical instructor was like, wow, I wish that every student would come in here and have this sort of energy or outlook. I think it'd be great to know as a student.
Oh yeah. Absolutely, a memorable experience, and I've got tons. But I'm in prepping for this question, I was reflecting on all the students I've had the opportunity to teach and get to know and work with as colleagues. And one of the biggest things that brought me the biggest joy, that made a positive impact on me, was when that student was when the student came in and really felt confident and really felt that they were a part of the team, but were able to kind of take their day, make it their own. And when they went off and they were able to work with patients, and then when the patients came to me and were just complimenting them on just the transition, and especially since I see them day one to the end of however many weeks I have the opportunity to teach them. If there's we see a lot of transitions, big transitions. Someone might come in a little bit more shy or reserved, and then they leave really confident, really outgoing, and just this whole other person almost has developed. And then when a patient sees that, and a patient sees, hey, wow, I just really want to take the time to let you know that this student has really done well, and if it were not for them, I wouldn't have gotten as good a progress as I have. And I love that. Not that I'm not taking any of the ownership of their progress, but I love when you reach that point with a patient interaction and the patient takes it upon themselves to compliment you on your student and their performance. And I mean, they act like I have something to do with it. I just start, I'm just the foundation here. I just kind of guided them and just kind of showed them the ropes. I get them to a point where they take it away and make it their own. But when they really have a positive impact on patients, and then the patients turn around and have a positive experience, with their therapy, because I mean, they're coming from, some of the worst days of their life so far, and then we give them a 180-degree, attitude turnaround and experience, and then they tell me that they've really enjoyed their time and experience with us. There's nothing you can beat that. It's a wonderful experience as an educator, and I think a lot of CIs who will see this and who I know that will experience that as well, because there's you can't put a price on that. As far as doing our job. Being a great educator and great person, allow that student to really thrive. And then, of course, patients get better. So then everybody wins in that scenario.
Yeah, I think that's something, even myself, just having completed my first clinical rotation, just feeling a lot more confident. I'm pretty well-spoken usually.
Oh, yeah.
So finding my voice in the clinic and really feeling like, okay, I know what I'm doing and I can use that confidence.
Oh,
I think
yeah.
It makes such a huge difference. So definitely.
I mean, and the patients are the best test subjects, right? They, when a patient comes up, I mean, I remember when I was a student and a patient came up to me and were like, I just love coming, I can't wait to get here to see you. And you build a good relationship with them and you kind of look forward to seeing that patient looks forward to seeing you. And then they kind of give you those words of affirmation of like, you're just doing a great job. I mean, I remember as a student, I felt like 1,000 pounds just got lifted off my shoulders because I'm, just trying to, experience everything and just do right and do everything the way I'm supposed to. And I don't know if I'm making the right impact on the patient or whatnot. And then the patient says, you're just doing great. Just you keep just doing you and I can't, I look forward to, working with you again and you're just doing an awesome job, or any of those that just give you that great little affirmation of like, oh man, I just, I finally, I'm in the right place. I'm doing the right thing. And sometimes you have to sit there as a student. Sometimes you have to really just step back and experience it, and just relish in that moment of, man, let some of that stress fall away, or let some of that anxieties or whatever that you may have in that scenario just kind of drip away and let the reward kind of hit you and then keep moving forward.
For sure. I completely agree. It's definitely a great feeling once you kind of shake the nerves off. And after those first couple of patients come in and they're so accepting of you being a student, treating them, and they're excited to see you next time, it makes all the difference. So the next question I have for you is, what advice would you give to students for their first clinical, both from a CI's perspective and then from the perspective of someone who was once in our shoes?
So good question. Great question. So I would say, kind of to piggyback on the first question we had, the first rotation, it doesn't matter what setting you're in. If sometimes students will come into a rotation and be like, I'm going to a skilled nursing facility, and I already have this bias that I may not want to work in a skilled nursing facility. I always tell students, don't go to your first rotation with some sort of overt either negative bias or positive bias, because sometimes and really, to be honest with you, I've had a lot of cases where both have happened, where students come in and they're like, because I work in a post-surgical orthopedic practice, where some students come in and they say, I'm not really into orthopedics, I'm more of pediatrics, and they get here and they love it. And then on the same token, the opposite, where they were really looking forward to their first rotation being an outpatient facility, and they get here and they're like, you know what, I'm not it wasn't what I thought it was, or maybe I found a new passion in some other setting. So I always kind of recommend to students, just come in with a blank slate, and my job is not to convince you one way or the other, but come in with a blank slate. That way there's always things you can learn, as well as from a CI's perspective. Do not try to convince the student that this is the best job in the world. Um, they're there to learn and teach. And I mean, when I meet students and I kind of ask for their, what are your goals? What are your likes and dislikes? Maybe they really love working in a hospital, acute care. Great. That's awesome. Hey, while we're here in an outpatient world, let's kind of go over some things that you might see in an acute care setting. Let's practice scenarios where you have to kind of do an interdisciplinary team for a patient, which is very much what you would see in acute care practice. And so a lot of times, first clinical experiences can start off on the wrong foot if they're already coming in with some sort of bias. And especially from another thing for a CI's perspective is we all treat differently. There's 1,001 ways to do everything. And sometimes the CI tries to really shape that student into something that they want to be. And that's not always the right case. That's not always the right thing to do. The student has their own strengths and weaknesses, and the student has their own, practice philosophies and different things that they like. The biggest thing is to just let them tell you and demonstrate to you what they like, and what they're good at, what they're confident in, and then use that first rotation to really mold and refine and kind of practice on some of those other areas. But that'd be the biggest advice just from the get-go on a first rotation for both student and a CI's perspective is just enjoy it, learn from each other. Don't come in with some sort of bias or preconceived notion of what it'll be. Just let it naturally, organically develop, and then work there and make the best of it for both the CI and the student.
Thank you. Yeah, I like that outlook a lot. I think it's important, even if you're in another outpatient clinic for, the next rotation that you have, if this is your first, you can always learn from different CIs in different ways, and not every clinic is the same. So definitely coming into it with an open mind for sure. So the next question is, what is something you wish your students would do more of during their rotation? So examples like asking more questions or having more confidence, things like that.
Great question. I would say the things that I would wish that they would do more during the rotation would kind of be let yourself make mistakes. When I was a student, there was this notion that we couldn't make mistakes, that there was no turning back, regardless of what we did. And when we really make mistakes, now, I mean, don't make, dire consequential mistakes, but let yourself trial and error on anything that you do. Because there's no one way to interview patients, and depending on who you see and how many patients you'll see, you'll end up finding various versions of it yourself. But I have a lot of students that kind of are get reserved, and they wanting to do something, they want to interact, they want to act or portray something that's very rigid, or they're afraid to fail, or they're afraid to make mistakes. And I tell them it's totally fine to trial and error. I can put a lot of money on that patient being very, very appreciative that you're willing to try something to see if it works, versus just not really care and give them something that may not, and hope, give it a lick and a prayer and hope it works. And so letting patients kind of let that, letting their confidence come up, but also let a little bit of that anxiety or that fear, per se, dropping down, that they can get to just relax and interact with the patient and work and find those trials and errors, and then learning from those mistakes, and then the next time try to do better, make it better, do more, whatever the case may be. But a lot of times, more times than not, I have students that just don't want to fail. They don't want to be, they don't want to be bad. They always want to see progress, which we all do. But a lot of cases, sometimes a lot of things are out of our hand. And so, and a lot of things don't necessarily mean it's our fault if something doesn't work right. There's a lot of variables that we're trying to guide and manipulate. And so being able to kind of just roll with those punches and make the next best step is how we become clinical experts. And so it's kind of a combination of all those things that I would say I would wish that students would do more on their first rotation.
Sure. Thank you again. So at this time, I'm going to just make a few announcements that we have. So first announcement is that core ambassador applications are open for certain states until August 30th. So the core ambassador for each state acts as a liaison between the state and national levels of student involvement. So core ambassadors take relevant updates from the national level and relay that information to students in their state to ensure that everybody stays up to date and engaged in our profession and our organization. So if you're interested in applying, please visit the engage.apta.org, and please reach out to any of us on the student board if you have any questions regarding applications. The student slate for the next student board will be announced in September, so definitely be on the lookout for that. Really exciting things. Next, the Csm Housing is open for the fall, so you can find more information about that on APTA's website. Next, the FAPTA is offering a Csm Scholarship that's opening at the end of the month, and you can also find more information about that on APTA's website. Those applications are opening up on August 29th, and that will be for 6 scholarships for physical therapist students to attend APTA Combined Sections meeting, and that's going to be taking place in San Diego, California, next year from February 22nd to the 25th of 2023. Lastly, the Outstanding PT Student and PTA Student Awards are coming up. So this award identifies student physical therapists and student physical therapist assistants, members with exceptional overall accomplishment and contributions to the APTA and the physical therapy profession. So again, you can find more information about those awards on APTA's website. All right, so let's move on to the next question. So this is kind of a very general question, but from your perspective, how can students get the most out of their clinical experience?
So to get the most out of the clinical experience, I would say it's totally one of those scenarios where you get out what you put in. I can teach you anything that you want to know, but if you don't want to know it, it might not be the best clinical experience, best learning opportunity. I've had students in the past who get a lot of information out of their rotation, much more than just clinical practice skills and things. For the students who I teach for the third or their fourth rotations or their last ones, we try to study for the licensure exam. We take time out of the day and go over practice questions, or go over material in another setting or another topic that that they may need to work on. As a student, your CI is a wealth of knowledge, not just in the setting you're working in, but just clinical practice, life, all kinds of things. And so while you have your CI there with you, and you've got a great relationship with them on a more casual level, you can ask them all kinds of questions. You can really pick their brain and let them mentor you on anything that you need or want to know or are curious about that they've probably either experienced or know someone who does. Networking is a very, very valuable resource. And so that's what I do. I mean, I've had the opportunity probably, I think, after I graduated and started residency and began practicing at this facility, I think we've hired on 5 or 6 of my former students that were, we cover job interviews, applications, resumes, and their skills were impressible. Made a great impression on our clinic owner and our supervisors and things. And so there was opportunities to bring them on. And so now I have former students who are now colleagues, coworkers. And that's a great experience for everyone, because then they are now CIs themselves, and they've taken some things that they've learned that I taught them, and they're teaching students themselves in their own way. So to really make it a great experience, you can get out of it whatever you want to put into it. And of course, I've had rotations where it's been very kind of cut dry, and students might just not be as interested to kind of get a lot out, and that's fine. I try to offer anything else as best I can, and if they take it, they take it. If they're not, that's okay. But I've had a lot of students who've gotten tenfold information, practice, confidence, just data of repetitions of different things, and I think clinically it shows for it. While we're here and we have some dead time, let's practice something. While it's free and while you're here, let's take advantage of it. So I would say for students who are heading into a rotation, or maybe just finished one, who might have been missing something that they wanted, or might have come to mind and say, "Ooh, next rotation I want to do this." Write it down, keep it in a note, and then that way your next rotation kind of tell your CI, "Hey, can we work on this at some point?" Even if it has nothing to do with whatever setting you're in or whatnot. I believe me, your CI will be very receptive to do that.
Perfect. Thank you. So before I ask the next question, just want to remind anyone who's watching on any of the platforms, if you have any questions that you'd like to ask, please put them in the comments and we'd be happy to ask Will. So next is kind of more about your style as a CI. So what is your style of teaching as a CI? Could you give any advice to other CIs that may be watching who may be taking on a student experience for the first time, and what you found as far as what's been successful with students?
So my teaching style is it's very organic, meaning I don't have like a straight written curriculum. I have kind of large milestones of things that we need to cover, depending on first rotation and on. Even in the first rotation, we try to cover everything. That does not mean we're just going to cover the history taking and be done. We're going to cover everything. I want my goal for a first rotation experience is to be able to have exposure and practice history taking, evaluation, exam, diagnostic treating, goal writing, documentation, talking with surgeons, working with the front desk, especially in a outpatient setting. You get exposed to all those things: the billing, the coding, different providers calling and communicating as an interdisciplinary team. So as a first rotation, I try to let everyone experience all those things. But my style of teaching is very collegial. First and foremost, I treat students as colleagues. I've said it before. I'm not an expert. I don't come across as I'm the all-knowing CI and make the student feel intimidated by any way. Whoever, if you were my student, I would almost casually call you Dr. Casey in front of patients, so that way they know that that you mean business, and that we're going to take this very seriously, and we're going to be colleagues. And I kind of give you advice and kind of give you guidance and what to kind of roughly do in an upcoming interaction, and then I let you take the rest, and I let you trial and error and find your way and do it the way you want, and I will guide you as little or as much as need be, as I can assess. And just for a tip for the CIs, I would highly recommend the Ci Credentialing Course that's offered by the APTA. It's a phenomenal resource that I've had the pleasure of being credentialed level 1 and level 2. But in those programs, they really teach you how to do that well and experience students who need a little bit of help, and then those who really need a lot of help. That way, you don't offer more help than needed or less help than what's required. And so when you kind of peg it right, almost, and you give just the right amount of guidance, advice, et cetera, to a student that needs it, it's nice, because in that way the student feels that you meet them halfway and you've provided them exactly the right amount of material or resources that they need. Either they asked for it or that you could kind of assess clinically, um, and then and then we just grow together, and then I swap roles. I love the role swap where I'm a student or I'm a technician, and I let the student practice delegating tasks, big stuff, small stuff. Hey, grab, can you get this patient of water? Sure, sure. And that way it lets the student really start calling the shots, right? And allows them to kind of start delegating tasks, because that happens a lot, especially depending on where you go. Being able to kind of compartmentalize what you need to do and not dictate, but tell or send another task on to another person, either a technician, a student, a PTA, another colleague, etc., on what needs to be done. That takes practice. It's just like anything. And so if we don't have a technician in the office or an intern or whoever, I become that person. And especially as the student really grows and develops himself, I am voluntold to take that position, and they're the boss. And I end up being a technician or a student for the rest of the time. And so, but it's really nice to really see them take those reins, and then provide advice kind of organically once we've met a lot of those milestones, and just refine with whatever time we have left. We just refine and practice and make sure that we don't leave any stone unturned, and all the corners of our practice skill set and things, and what we need to work on is covered. And so, but that's worked out well. That was one of the teaching styles that I enjoyed when I was a student. And so I think it's a very active, both teaching and learning style, because it's more organic. It's kind of, we start the stage and then kind of see where the interaction with the patient goes, and then moderate it as we go. And then it just gets smoother and smoother and smoother and smoother. And then it's like clockwork. And then, we're doing great, students doing great, patients are doing great. And then boom, you forget you're a student, and then we just rock and roll and do as much as we can for the rest of the rotation. And unfortunately, like we said before, then fortunately the rotation ends, and you're like, exciting to see him come, and I hate to see him leave. But at least we know that when you finish your first rotation, that you are well equipped to head back to school or head to your next rotation, and you've got a lot of clinical experience under your belt that will definitely show for the next group of patients and people you work with, and you can't ask for much more than that.
Yeah, something that you said that kind of sparked an idea for a question in my head was, as a first-time student in the clinic, it was difficult to, when using the CPI and going through all the tasks that you do every day and how to grade yourself and be really self-aware. One of the topics that really was difficult for me as a student was the delegation of tasks. So like you said, could you give any advice or share any experiences of how you've kind of implemented that into the experience slowly? Because I think that's something, at least for me as a student, it's hard to feel confident enough to be able to delegate tasks to others in the clinic, just because you feel so fresh and so new in the environment. So yeah, any experience that you've had with that? Great.
I always say start small. Don't start off by delegating an entire patient daily session program off to someone else just yet. Small things. Do small things first. Delegate. Hey, can you help me bring back patient so and so? Okay, then I say, okay, where would you like me to take them? And basically, what that loaded kind of question is, do you know how you want that patient prepped? Do you want them on a table? Are we going to start with something active? Do you want them in a chair? Little things like that. Just prep the environment. And so sometimes if the patient already doesn't come in to the office immediately, then sometimes I'll come up to the student and say, hey, would you want me to bring back your next patient, or so and get them started? And so that just fronts the delegation part of it, where then the student says, yeah, oh, thank you so much. Do you mind, starting on the plinth? We're going to do some table stuff first. I'm like, yeah, sure. So it begins to where I almost ask for a delegated task if I'm not already told. And so that kind of lets the student just know, okay, what's that first thing that I would want? Because, you get all of those steps already lined up in your head. I mean, you write out an entire day with the patient. It could be 100, 200 things, like different individual steps, depending on how finite you want to label them. And so it's almost hard to kind of, where do I start? With what task do I start? And so I always say, start small. Start first, start small. Start, interacting with the patient. Do you want to ask them how their day was? And then I can kind of tell you, because that's another skill that, you kind of have to practice is you might work with a patient that I see, or I see that you actually see. And we may take a 15-minute conversation, and I have to kind of consolidate it down to maybe a real quick find, because I got to do documentation later or that moment. And so being able to kind of discuss an interaction that way, both with the student as if I'm a student or I'm a technician, and vice versa, um, gives another example of something to do. Sometimes the student will tell me, hey, thanks, Will, can you bring them back and kind of, just see how their shoulder was? We really, we really worked on it hard last week. I just want to kind of see how it's doing. Yeah, sure. So I'll ask the patient how it goes and how the shoulder feels and what was hard, what was easy, how they felt last session went. And then I'll kind of compartmentalize that and can make it concise. And then I'll tell the student later, and then that's how we'll document. So there's 1,001 different things to delegate. It's not just, sometimes they'll say, I need to delegate tasks. Let me do the whole session. You don't have to do that. It can be little things that build up over time. And surprisingly, I mean, sometimes you can go from, if you did it within the week, Monday are small tasks. And then by Friday, it's like, hey, can you do, this. And then I want you to finish with this. I'm like, yeah, sure. Absolutely. Yep. Roger. Got it. It's just it's so fun to kind of see that transition of not only the confidence, but that kind of preemptive planning that the student already has, where they kind of already know exactly what they want to do or need to do, or want to double check on this time, and then they just list that out for me to do, and I'll do it the way they want me to, and they get to really practice doing all that stuff. So, if you really like, especially as a student, if you want to start taking on things like that, and maybe the CI doesn't offer that practice of delegating tasks, sometimes, just meet with the CI or saying, hey, and just kind of say, hey, do you mind starting my next patient? And just kind of taking that initiative. And that's great. That's not disrespectful. That's not going to be turned away. A lot of CIs really enjoy it, because that way it just helps with the smoothness of the day, depending on the setting that you're in. And so sometimes if you just, take that task in your hands and say, hey, do you mind starting this patient or finishing this patient? Or can you tell this patient, this information? Sure. And that way you confirm that collegial relationship that you have, that it's, we're working here together. We're not, it is my way and your way. It's, I'm helping you evolve, you're helping me. And that's the best way to make it a team effort. And then that also helps a relationship between the CI and the student, because that way you almost kind of read each other. You almost kind of develop this unspoken language between you, where sometimes you look at each other and you kind of already know what you want to do or what the other person needs to do. And that's cool. That's a little CI student, telepathy kind of action. So, but when you get to that point, it's like, yeah, we've got a good thing going here. And then you just kind of keep just evolving that as you need to.
Yeah, I really like that, because that's something that, how it's written in the CPI, I feel like at least to me, it was very intimidating to think about delegating huge tasks. That's what crossed my mind. Like, how am I going to do this for my first rotation? But taking it slow and starting with simple tasks, it definitely makes it sound more achievable.
Oh, yes, absolutely.
So another question about how a student can prepare for their first clinical with the goals that they should come prepared with wanting to meet midway through and then final. I know that's kind of, it could be different depending on the setting, but in your experience, what are some good goals that students have made for themselves to reach at midterm of the clinical and then at the final clinical, just for, and it's sometimes a requirement for, some classes to write goals and then go over them with their CI. So anything that you've heard that sounds achievable and is a really good goal.
Oh, sure. Goals can be, I try to make goals if they don't already have them. I do ask them, what are your goals? And sometimes they say, I want to, goals are sometimes, they can be, 1 foot goals, meaning like right there, like a finite detail. Like I want to, I want to be able to perform a manual treatment on a patient and get a cavitation. That can be very finite, or it can be very 30,000 foot view, which is I would like to, by the end of this rotation, have a much, work on my nonverbal skills, as an example. So there's a huge plethora of diversity among those goals. But for like midterm things, depending on where they are when they start, I always tell them, let's have the end in mind, right? So that way we can use the midterm goal as a good benchmark for where we need to be. Because sometimes we can actually beat that benchmark by time, and we say, hey, since we kind of hit your final goal at midterm, let's kind of up the final goal, right? And that can be, I would like to be able to evaluate a patient and correctly diagnose them and begin them on a treatment plan and document that evaluation. And so I'm like, great. So for that, say, if that's a final goal, one whole full on evaluation, documentation, everything, sign it, seal it, deliver it. Then midterm, I say, all right, so let's break it, into pieces. Between now and midterm, let's do, the evaluation, the history maybe, or exam, or you throw out different diagnostic tests. If it's surgical, kind of make sure everything is what it should be and nothing that there shouldn't be, as well as a good, plan of care, treatment plan that we can plan up for them. And then you just kind of build that onto it. And then a lot of times students will achieve that goal much faster, depending if we have a lot of evals and their comfort level of evaluating new patients. And so a lot of times they end up by midterm already seeing that patient and then going for the full gambit of an evaluation and then documenting. And so then I'm like, okay, well, then if that's, we're ahead of schedule, then by the final evaluation, let's do 3. Let's do 3 kind of independent or 4, depending on, what you want to do. And so you can grow the goals and let them be very organic, just depending on what you see and the comfort and the speed of progress on those goals. But those are kind of like hard goals where they could be like almost pass fail. Then you have kind of soft goals, which are, let me work on my my rapport with patients, or my verbal nonverbal skills. Let me work on my poker face when I might feel that if I feel I get stumped, and I almost immediately show, my poker face, right? Or I have a really bad poker face, and the patient almost immediately kind of says, oh goodness, I really stumped this student, because, cases like that happen all the time. And so I'm like, yeah, sure. So then, just with practicing and the more exposure with patient interactions and hoping that the next time something kind of, unique shows up and that student does not immediately throw up their really bad poker face and has a much better way of realigning that interaction so that they're like, oh yeah, sure, no problem. And, and kind of rolling with those extra punches that we didn't see coming. And then the patient feels very confident that we've got it under control. Sure. So it can be little things like that. And if they don't already bring it to my attention, sometimes if I notice that, then I may offer that as a goal. But I always ask them for their goals are to see what they kind of already know. Because of course, with anything, if you don't know, you don't know. And so sometimes with just the practice of exposing what you think you know, and kind of also let enlightening them on what they may not know, that develops its own goals. And then so we can go weekly goals, end goals, final goals. But I try to make them as organic as possible, just so we're not kind of just rote, no frills curriculum or anything like that, where we had to just achieve this goal and then when we're done. Because I would much rather roll with as fast or as slow as we need to accomplish everything that we want to do with the time that we have. And that can be short first experience, or if their first experience is longer or shorter, whatnot. Your goals can be completely personal and organic. So don't feel like you have to make these goals and kind of have to achieve them within a time frame. Make them as organic and flexible as possible.
Perfect. So for me personally, one of my goals was to become better at time management, because I think that's something in school. It often seems like you have a lot more time in school, and they make you think that you can get a ton of information and subjective histories, things like that. But in the real world, it seems like there's just not enough time to get all that information and be efficient with finishing documentation, things like that. So do you have any suggestions for first-time clinical, how to prepare in terms of time management skills?
Sure. No, great question. Great question. That happens I get that all the time, where you can see, especially when you really get into the clinical experience and you really see how fast 5, 10, 15 minutes feels, right? I mean, when you're in class and you kind of going over, okay, this will take this long roughly, and I'm going to budget this time, and then you get into a rotation and you really experience what an interaction, what 5 minutes feels like. Sometimes it feels like 5 seconds, or you allot yourself X amount of time to do something and you feel like it takes an eternity. You're like, oh my goodness, like I didn't expect this to feel so long. I only plan to do these exercises. Now I have to find more to fill up the time, So the time management can be on both sides of that spectrum, where you feel like you're either rushed or you feel like you're dragging and you got to like fill the void. And so what I kind of offer up for my advice for students is kind of have a little plan in place as far as what you want to do, what you are planning on doing, or what you think you need to do, but always have a little bit of wiggle room. I tell patients, time for like an evaluation or a treatment session, it doesn't have to be very blocky. Blocky meaning I can only allot myself 5 minutes for this, or 5 minutes for that, or 10 minutes for this. Let it flow among each other, and depending on who it is and how comfortable they are at going with the flow per se, quote unquote, the flow can evolve, and the flow will be the speed of the day. In an outpatient setting, it can be, we may only have one patient in here, we may have a couple more. And so it can be a little wild depending on the time of day or the day of the week it is. And so sometimes we can really slow down and enjoy the time and practice what we need to and get all the things we need. And sometimes we have to be a little quicker movements in between things, just because of the flow of that day. So with time management, we kind of sit down and say, okay, really how long, quote unquote, should, first and foremost, how long, should we think it takes? And then how long, is it currently taking us? Because if documentation, if I'm just a slow typer or slow documentation, then I want a lot more time for that. So let's kind of let's reflect on the interactions that we have and see how can we kind of maybe consolidate them a little bit. I'm a talkative person. We can talk about everything under the sky here. And sometimes sessions can go a little overboard, a little long, and I have to kind of accommodate that other ways. And so that's me, where I'm like, I just got to, quit going into my life story every single session and try to consolidate a little bit, just so that I can account for some extra documentation time, because I'm a little slow typer right now for whatever it is. But then as you practice that, it'll get better. So it really helps to just sit down with your CI and kind of go over if you have time, and just no pun intended, you always have time to. You always have time to sit down with your CI to go over something like this, where you say, I'm a little slow in this, or I'm a little, I feel like I'm pretty good with this. I want to go on and move on. But yep, absolutely, absolutely, because that management is very organic. The management's got to be very flexible, and I think the skill of managing your time drastically separates your novice practitioner from your experts. And even as a student, you can experience that. Your management skills from first day of your rotation to your last day of rotation is going to be vastly different. And you being able to kind of see that and be flexible in real time, that's a very, very good skill to have for any setting, every setting you go in, because all kinds of things can happen. And you got to be able to kind of go with the flow and speed up or slow down as you need to. And feeling comfortable and confident to do that is that speaks volumes to your colleagues and to the patients and everything. So going definitely, taking that time to go over your time management. And of course, there's a ton of different ways to manage it. Do I need to delegate it? If this task is taking me a very long time to do, maybe it's good if I just delegate that to Will, because maybe Will can do it faster, and then he can teach me a faster way the next time. And then that way that'll free me up time to kind of do something else. So that's kind of when that conversation about the delegating. So like all of these things are all interconnected, and it's all these little things that we kind of take for granted sometimes in a day of all the things that we do. But this is just a great example, a great opportunity to take to kind of cover those things if you don't already have the opportunity to cover them.
Definitely. I really like that idea, because it's something that for time management specifically, I was trying to think of how are ways that I can improve this, and in writing, how am I going to show that I can improve this skill? But using the delegation of tasks is a great option, definitely.
Mm-hmm.
So we have a question from the audience from Thomas. He asks, how should students respond to days where it feels like they have little impact or contribution that day, or in general feeling overwhelmed with how little you know in a new situation?
Great question, Thomas. So if you feel like I believe the first part of the question, if you feel like you're not engaged, is that correct?
Yeah, where it feels like you've had little impact or
impact. Right, mm-hmm. Right. So that happens a lot, where sometimes the CI might be a little reserved as far as allowing that student to kind of interact with patients, or allow that student to be involved in the day-to-day operations of that setting, that day's schedule. And I would recommend probably taking the time to maybe the beginning of the day to just kind of meet, like when you kind of get together and you kind of look at the outlook, if you kind of know what the day looks like, and offer up, hey, would you mind if I take the lead on introducing myself to these first few patients, or you can either offer it up directly like that, or you just say to the CI, say, hey, do you mind if I, just introduce myself to the next patient that we see? And then you kind of have to let the CI know that you want to be a little bit more engaged in that setting, because the impact comes from taking the time to actually being a part of that patient interaction. If the CI sometimes like runs the show and they don't let you do anything, and you feel like you're like a fly on the wall, that's not productive. That's not a positive learning experience. The CI has to step back and allow you to experience that, because that's the only way you'll really, really learn and really solidify those things. And so if you don't have the opportunity to kind of get engaged with the patients and with the evolution of the day, then yeah, you would totally feel like you're not making an impact, because you're like, I don't feel like I'm doing anything. And that's not a good use of your time, and that's not very good for a CI to allow that to happen. So I would recommend, just reaching out to the CI in the morning, like when you get together before the day starts, that calm before the storm, and just say, hey, do you mind if I do this or do this today? And that way the CI can see that you can do it. Sometimes it just takes that, where you just have to kind of show the CI, hey, I know this, I can do this, right? And then once you do that and the CI sees it, they're like, oh, great. And then that'll evolve into other things. And then you'll get that impact, because then you'll be more readily evolved, or, they'll let you be more free to kind of move around the cabin, as they say in the clinic. So great question.
Perfect. So thank you so much. I'd really love to hear any other advice that you can think of to kind of round this conversation out. I know we've talked about a lot here, but any advice that you would give to CIs, to students for the first time going into the clinic, would be super helpful.
Oh yeah, I would say the best advice, like I was given, is your clinical experience is one of the most vital opportunities you have to learn in school. Without a great clinical experience, all that you learn in the class, all the things that you'll cover, all the topics, they won't really come home unless you can really experience them in the clinic. And that's what the great thing about being a clinical educator is that we have the opportunity and responsibility and the privilege to put you in that position so that you can solidify those things, that we can cover those topics, that we can actually let you see and work and experience patient interactions and patient cases and conditions and diseases and all kinds of things that happen that you have just read about in textbook. Especially depending on the setting. I mean, even here in the post-surgical world, we deal with, we have DVTs and PEs and some medical stuff, primary care. We have a lot of autonomy here. I do a lot of primary care practice and letting students see things, or if we have a really unique case where something kind of comes up that you don't normally get to see, and it's very rare for anybody, but allow the patient to, or the student to experience that. So that way when the student goes, hey, I've seen one of these before, that way when I was a student, my CIs would say, that's how you can really remember and confirm some of the things that you cover in school with a patient interaction, so that in the future, if you have to take a test, or definitely when you get your license, when you're ready to take your licensure exam, you have a patient interaction, a patient experience that you were part of that talked about the very same thing. So you're like, instead of having to kind of regurgitate from the textbook, you're like, hey man, I remember this patient I had who had the same thing, and this is what we did, and it would look like, and boom, you got the right answer. And so you build off of that. But that's how I hope my students get to experience in their clinical experiences, especially your first one. Say, this is the first step into starting to put into play all those things that you were taught and you learned or you heard about. You get to experience them. And experiential learning, it goes much deeper than just rote memory, or even memory. You get to experience it, and you get to put a face with the condition or things like that, and that allows you to recall better, and see how it works, see how you interacted, see how the patient did with whatever the case may be. And so school's expensive, and but it's well worth it if the clinical experience is equally as valuable as the material you get in the classroom. And so I try to make my clinic experience for either first rotation, last rotation, everywhere in the middle, to be the best that it can be for all of those reasons. That way that student really gets a great learning opportunity, and for me as well, so that I can learn a ton. I feel like I've studied for the MPTE 8 years straight now, covering all that material. But it's wonderful because as things change, and I can see how, and especially as a CI, the more clinical education I do, I can start seeing like trends in some weaker areas or stronger areas. So I can almost like front the experience and say, hey, I've seen a trend of some hard time learning this stuff. Let's take some time to learn it. And the student's like, oh yeah, that's exactly right. It's just a hard topic for everyone to grasp. I'm like, let's learn it together. So, but I would definitely say for any CIs out there, just take that opportunity to really, you to grow and learn, allow your student to grow and learn, and everyone wins in that. scenario. That way, when they graduate and they become a colleague in our great profession, we're making it better one student at a time.
Thank you so much. Thanks for sharing, and thank you for being here and participating in this event. And thank you for everyone tuning in on social media and asking questions. If you could please share your contact information, Will, so that anyone who has any questions can reach out after tonight.
Yeah, sure. I'm on Facebook, William C. Stokes. You can find me there. Shoot me a direct message, as well as my email. It's w.c.stokes@wingate.edu, WINGATE. You can have my email with me all the time. Shoot me a quick email, ask me a question. It's very easy. Respond as quick as I can. And if I don't know it, I'll be hard pressed to find someone who doesn't know the answer. So don't feel afraid to send me any question anybody has.
Perfect. Thank you all again. Thank you, Will.
Thank
I hope
you.
you all gained as much from tonight as I did, and feel very prepared for your first clinical rotation. And for anyone starting their first rotation coming up this term, good luck. So have a great night, everyone.
Bye, everybody.